Welcome to another episode of my Antenatal Health Talk. How is the pregnancy journey going? I wish you a safe delivery. If you have not subscribed to my channel, please subscribe and tap on the bell to get notifications anytime I post. And if you have not watched the previous episode of my Antenatal Health Talk, please try and watch it so you can catch up with this episode. In this episode of Antenatal Health Talk, I'll be talking about malaria in pregnancy. Let's get into the video. Pregnant women are vulnerable to malarial infection because of their suppressed immunity. Early diagnosis of malaria during pregnancy can be life-saving for both the mother and her unborn child, because some pregnant women might have malaria and might not show any symptoms because the parasite enters into the bloodstream and hides inside the placenta, which makes it very difficult to detect. Malaria during pregnancy can cause a lot of things like miscarriage, maternal anemia, fetal growth restrictions, and can also lead to both maternal and neonatal deaths. Malaria is caused by mosquitoes, and getting rid of mosquito is like getting rid of malaria. Now, during pregnancy, how do we prevent malaria? There are 3 ways to prevent malaria during pregnancy. The first is all pregnant women should sleep in treated mosquito nets in order to avoid being bitten by mosquitoes and getting infected with the malarial infection. The second way to prevent malaria during pregnancy is the intermittent preventive treatment. What happens here is that your healthcare provider gives you drugs that prevent you from malaria, and this drug is called sulfadozine pyrimethamine, and this is given after 20 weeks of pregnancy. You can get 2 or more doses, which is why it's very important that you attend your antenatal appointment in order not to miss out, because sometimes pregnant women might have malaria and might not show symptoms, just as I've said earlier, because the malaria parasite might hide inside the placenta and cause damage to you and your unborn child. Malaria, don't feel like you have malaria and you just sit back because you say, I just have malaria. You take it lightly. No, malaria is very dangerous. In the later part of this video, I'll be discussing some complications of malaria. So whenever you have malaria, make sure you take it seriously and make sure you attend your antenatal appointment in order not to miss out with the intermittent preventive treatment. The third method of preventing malaria during pregnancy is by keeping the environment clean, because when the environment is dirty, when there are accumulation of water, grasses everywhere, it helps to aid mosquito growth. So to avoid that, you need to cut the grasses. You can ask someone to help you. Then avoid accumulation of water around your area. This will also help in order to prevent malaria in pregnancy. What are the symptoms of malaria during pregnancy? Malaria symptoms can be divided into 2, which are the complicated malaria symptoms and uncomplicated malaria symptoms. Let's start with the uncomplicated malaria symptoms. What are the uncomplicated symptoms of malaria? First, we have headache, we have fever, we have chills, we have joint pain, body pain, nausea, and vomiting. All these are symptoms of malaria, like they are the uncomplicated symptoms of malaria during pregnancy. Complicated symptoms of malaria during pregnancy, we have drowsiness, we have severe anemia, jaundice, dehydration, amongst others. Malarial treatment during pregnancy. During pregnancy, if you have malaria or if you have symptoms and you feel you have malaria, 1, don't do self-medication, and don't go and get drug over the counter to treat malaria while you are pregnant, because some malaria medications are not safe at all during pregnancy. While some are safe at some certain stage of your pregnancy, you can take them, and at some certain stage of your pregnancy, you can't use them. So anytime you feel you have malaria or you have symptoms relating to malaria symptoms, make sure you go to the hospital or see a healthcare professional in order to give you the right treatment for malaria. Malaria during pregnancy. There are a series of complications that might arise when you have malaria during pregnancy that is not properly treated or that is left untreated. I will be mentioning a few of them. First, we have maternal anemia. Second, we have miscarriage. And thirdly, we have low birth weight. Fourth, we have neonatal jaundice. And fifth, we have some developmental issues like fetal growth restrictions. Thank you for watching this episode of my antenatal health talk. Hope this video was helpful. If you feel any symptoms or you feel like you have malaria, make sure you go to the hospital so you can get tested and get treated. Never do over-the-counter medication. Never do self-medications when you are pregnant. Any symptoms you have should not be taken lightly. Make sure you see a healthcare professional in order to get the right treatment. Thank you for watching. If you've not subscribed to my channel, please subscribe and give this video a like. In the next episode of my antenatal health talk, I'll be talking about vaginal discharge during pregnancy, the normal and abnormal. Stay tuned.